This healthcare centre in Gui village in the Abuja Municipal Area Council was provided by the EU-signed project in 2017 as part of its pledge to assist the Nigerian government reduce mortality of children under age 5 due to vaccine-preventable diseases and revitalize 10,000 primary healthcare centres across the country. The project also enjoined the provision of vaccines, vehicles, solar freezers, renovation of structures and other equipment to rural communities without facilities. The project, which has lasted for 17 years, also got a funding of $200 million. The project has now ended, with the EU ambassador saying that Nigeria has to remain committed to the sustenance of it through proper funding.
And two, so 17 years non-stop, we have partnered with Nigerian authorities, with civil society, with state governments, because there's still a very significant challenge. And I think we come at this crossroads where we need to look at what are the results, what can we do differently. So when we look at defining our priorities for the future, this is something that we will take into consideration. And as always, in support of Nigerian initiatives, Nigerian policies, Nigerian visions, because it's not possible to solve all the problems in Nigeria with international donor cooperation. It is just too big and the population is growing at the same time.
Other developing partners like the WHO and the Nigerian Primary Healthcare Development Agency commended the effort of the European Union, which they say is key to us achieving the target for universal health coverage.
And we cannot underestimate the effort which they did, because if you look back, a lot of solar refrigerators were given to states in these programs, and you know what solar refrigerator is to immunization, because you have to get the vaccines very potent, and that is just one of activity I can just lay a hand on and say yes, they contributed immensely.
I also want to make it very clear that the job is not yet done. We have just reached a milestone recognizing that there's not been a case for the last 3 years, but there is now a process to validate that, to evaluate whether indeed Nigeria has achieved that interruption and that Africa is worthy of certification.
There were also calls to the government to expand and sustain the project in the country, especially at a time when Nigeria is almost certified polio-free.
I would like our government to make sure they follow this footstep of EU in providing necessary health facility to the appropriate place.
23 states, including the FCT, benefited from the EU-signed project. The aim of this event is to review successes, challenges and recommendations. It was also aimed at advocating for the need to bring healthcare services closer to the doorsteps of Nigerians' teeming population. Ihotu, AIT News, Abuja.